protein. And here's the bottom line. The fibroblasts and the collagen form that framework, that scaffolding, that foundation in order to be able to proliferate granulation tissue. So 3 words if you're taking notes: fibroblast, collagen, granulation. That's what I want you to visualize. Fibroblast, collagen, granulation. And here's the protein. It's a triple helix. It's tightly coiled. It's in that braid form. It's composed of special sequence of amino acids. We have proline, glycine, hydroxyproline, and they repeat. So these amino acids are unique to the collagen molecule. Unique to the collagen molecule. This is what it looks like. So when you're using our products in the clinics, I want you to visualize this, because this is what you're putting into the patient, and you're having the activation of the fibroblast to produce that granulation tissue. This is the #1 main player here. This is what I mentioned before. The fibroblast is the main cell to produce granulation tissue. And look at this cell. Here's a picture of the cell. As we remember from our school days, for cellular biology, we usually think of cells as round structures, correct? This is specialized. Look at the morphology of this cell. We have a unique looking nucleus, but look at this. We have a branched cytoplasm. The branched cytoplasm allows the cells to interact efficiently and effectively to cleave, to grab the collagens. And here's what it does. It forms the matrix of the wound bed to produce granulation tissue. We see that it's the main structure that ensures the integrity of the connective tissue. Most organs of the body contain 2 separate structures. We have the parenchyma and we have the stroma. Let me give you a few examples. The spleen has a parenchyma and a stroma. The lungs have a parenchyma and a stroma. The parenchyma means the functional tissue. The stroma means the structural tissue. But in order for the functional tissue to perform, it has to have a good structural foundation. Let me give you an example. This room right here. In order for these walls to stay in their position, we have to have a good foundation. This is the stromal makeup of this room. In this stromal makeup, we can put the walls, we can put the ceiling, we can put the roof. The same principle with the fibroblast. The same principle with the stromal integrity of the wound bed to be able now to encourage the development of granulation tissue. Same thing with your homes. In order for the walls to stay up in your house, you have to have a good foundation. You have to have a strong foundation. Visualize that so when you see a wound, you say to yourself, here's my goal. I'm going to use these products to ensure the integrity of a foundation in order to grow granulation tissue. And the granulation tissue is the functional tissue. Does that make sense? Okay, very good. Now, here's my favorite slide. There's a lot of information on here, but here's what I'm going to tell you. I like to look at this slide and think of a symphony. Let's visualize that for a second, of an orchestra. The conductor of the orchestra is the fibroblast. And in that symphony, we have the string section, the horn section, the percussion. We have all the sections. The fibroblast tells these sections, influences these sections as to doing other subcellular mechanisms. And here's what they are. We have migration and proliferation. We have extracellular matrix foundation. That is the stromal network that the fibroblasts are going to emerge. We have growth factor liberation, angiogenesis. We heard that word moments before. Angiogenesis in the Greek translation means new blood supply. So if we look at it as a plant, and we put fertilizer in the plant but don't water it, the plant's not going to thrive and grow. The same principle with the wound. In order for us to grow good quality granulation tissue, we have to supply it with a blood source. And this is what angiogenesis does. It supplies that wound with the right nutrient qualities, in addition to the collagen molecule that we have in there to grow and proliferate. So we have angiogenesis. And then we have protease release, because we don't want to have an increased deposition of fibrin. That's not good. So we want to have a balance of good collagen. So the take-home message of this slide is the fibroblast is the main influential slide to getting to a point of wound resolution. Okay? A lot of information, but that's your take-home message. All right. So then we go to, well, what's the relationship between collagen and fibroblasts? Very simply, the collagen and the fibroblasts form that relationship, form that framework, and now they're able to form that cellular foundation, activate all the subcellular mechanisms that I just mentioned moments ago, and to produce granulation tissue. And that's what happens here. We see that the collagen fragments are chemoattractants, they're chemoactive for fibroblastic migration, for the fibroblast to move in that wound bed to produce the tissue that we want. Okay, so now we have the cousin, or I like to say the best friend of the fibroblast is the macrophage. If we're going to remodel our house, we need to have the demolition crew come in, right? To take down all the stuff we don't want to show in the new house. That's the macrophage. So the macrophage has specific influences to travel around that wound bed to remove devitalized tissue. Once the devitalized tissue is removed, then we can have a beautiful foundation from the fibroblasts and the collagen to produce granulation. Now, we see some similarities here from the fibroblast slide. We do see that we have angiogenesis, but unique to macrophages is phagocytosis and antimicrobial function. Phagocytosis is a fancy word for eating. So we don't want to have that cellular debris. We don't want to have that slough grow in that wound bed, because it's going to interfere with all the nice, beautiful, red, healthy, viable, pink fibroblastic granulation tissue. We got to get that wound bed prepared. And the macrophages assist in that process. As well, in every other subsection here, we see a similarity again, the liberation of growth factors, which is so important and so unique. We need growth factors to be able to do the right things in the body. Here's a very unique and cool thing. In order for a cell to form a specific function, it needs the permission of something else. In this case, that's a growth factor. Because if we have cells that run on their own without any immunologic surveillance, what do we have? Any guesses? Cancer. Cancer are cells that run on their own. We call them rogue cells, and they don't have any surveillance. So in this case, in order for you to attain cellular efficiency, you have to have those growth factors, which are called cellular mediators, to tell one cell to do a specific function. And then when it does its function, it stops. And that's so unique to the body's function. That's so unique to the immunomodulation of the body. So this is what this slide tells us that we're going to expect. Okay, I put this up here, so I want to differentiate between